The thyroid gland, here at the base of the throat, controls how our body uses energy. For millions of people, especially older women, the thyroid has stopped making enough thyroid hormone. It's called hypothyroidism.
And when that happens, bodily functions can slow down, including digestion, energy level, heart and brain function, and calorie burn. So we met with Dr. David Borenstein to answer some common questions about hypothyroidism. Number 1. Who gets hypothyroidism?
Everyone gets hypothyroidism or can get it. It can occur from the very young to the very old. And I think many patients have had it, never knew they had it, and because of the increasing awareness of hypothyroidism, more and more patients are diagnosed with it. It's more commonly found in females, but it can occur in males, and it can occur in any age group.
Number 2. What is TSH, or thyroid stimulating hormone?
Thyroid stimulating hormone is secreted from an area of the brain called the pituitary gland that it signals the thyroid to make thyroid hormone. If the levels of TSH are high, it means the thyroid is not responding very well. Therefore, high levels of TSH indicate a low thyroid.
Or what's commonly called hypothyroidism. Number 3. How is hypothyroidism treated?
Hypothyroidism can be treated a number of different ways. The most common way is to treat it with medication. Many patients, or most patients with hypothyroidism, have what they call Hashimoto's thyroiditis. This is a disease where your body attacks your thyroid. And the goal in treating Hashimoto's is to reduce the actual level of the antibody. That can be done with supplements such as selenium and dietary changes, gluten-free diet, avoiding dairy. And in addition to that, avoiding what they call goitrogenic foods such as soy, which can block thyroid production.
Number 4. What's the difference between hypothyroidism and hyperthyroidism?
Hypothyroidism is when the level of thyroid in the blood is low. Hyperthyroidism is when the level is abnormally high. With hypothyroidism, weight gain is a common problem. With hyperthyroidism, weight loss is a common problem. Instead of feeling cold with hypothyroidism and hyperthyroidism, you feel warm. Instead of having constipation as you do in hypothyroidism, you may have diarrhea in hyperthyroidism. However, both diseases can cause hair loss and even fatigue.
Number 5. Should I ask my doctor to check my TSH level during my annual physical, or is it already covered?
You should ask your physician to make sure so you know at least you're getting some thyroid screening. I personally would ask my physician to check additional thyroid parameters such as free T3, free T4, and reverse T3 in addition to the TSH to get a more complete picture of thyroid levels in the body.
And finally, number 6. Are pregnant women more at risk for hypothyroidism?
Yes, pregnant women are definitely more at risk. As the pregnancy progresses, the metabolic needs of the body increase tremendously, which can put a strain on the thyroid. So if your thyroid is low to begin with, it'll get even lower when you're pregnant. So that should definitely be screened during pregnancy.
With Everyday Health, I'm Taryn Brill.